Hey there, this is my cumulative final. Just want to show what I all got here. I have a bunch of different supplies for medications. I'll cover some flushes. I got a setup for a dressing change. Got my book with my meds looked up. I have MAR simulation here. Some orders from the doctor. Something set up. Some flushes here. Per the scenario, I have a line set up through a pick hooked up to a normal saline running at 100 an hour. I had a Betty book back here, which is set to one of my medications to check for compatibility, which should be fine now. And then we will get started with our scenario. So what I would do is coming in, I provide for privacy, pull this way around, try and keep my voice down because everybody says I talk very loud. Alright, introduce myself. My name is Kyle. I'm going to be a student nurse today. And I got some orders from Dr. Banner as far as what we were going to do for you. Frances, is it? And can you give me your full name and date of birth? She states Frances Christensen and her date of birth. 3/24/42, which matches what I have on the MAR and her orders here. So Francis, sounds like we're coming in a little dehydrated. They got some fluid for you at the ED, which is good. We'll leave that running. And then we got your labs back, and it's showing that your potassium's a little bit low. I do have that here, so we're going to get that set up for you. Alright, so I got my stuff here. Sanitize my hands. I got my potassium chloride here. So I'm just going to go through my 5 rights 3 times. I already ID'd Frances, so I got Frances Christensen, date of birth 3/24/42. She's getting potassium chloride, 10 milliequivalents in 100 milliliters. Saline, that is going to be stat via IV piggyback. Frances Christensen, 3/24/42, potassium chloride, 10 milliequivalents in 100 mils. IV piggyback given stat. Frances Christensen, 3/24/42, potassium chloride, 10 milliequivalents in 100 milliliters. IV piggyback going to be given stat for potassium. I have those checks done. Alright. Got my tube in here. I'm going to relax, set that on the bed. Then, typically if we could, we'd run this. Piggyback in a way to not waste any fluid, which I'm going to try not to do using no touch technique. We're going to spike our potassium. And making sure my lab is closed. I'm going to take this. I'm going to open up in my bag. Alright. And because I'm going to need to clean here shortly, I'm just going to throw a set of gloves on. Looking at what we have for our rate on our potassium, you can't give it more than 10 milliequivalents over an hour, so that rate we will set giving our stat is going to be 100 milliliters. If there's any complaint by Frances that like her IV is burning, we could then slow down the rate a little bit, but from what I understand, she's going to be going for CT scan here shortly, so if we can, we'd like to. Alright, and I got that to the end there. Alright. Then what I'm going to do is grab one of my alcohol swabs, and then we are going to Y this into our normal saline. They are compatible. So I'd come to my Y port, I'd sanitize here 15 to 20 seconds and let air dry. And this would get connected here. All right. I just want to set this here for later. That way that doesn't go all over the place. We get our second channel set up. All right. Had that problem before. So, channel B. I'm going to go into our guardrail drugs. We got potassium chloride. We are going central since it's going into a pick. I don't have that set up here, so we are going to input it. So we have 10 milliequivalents in 100 milliliters, as shown there. Next. Since we can only do up to 10 an hour, we're going to run the 100 over 1 hour. That's the fastest we can run. We may have to come back from that. We're going to infuse all 100 for our dose. I'm then going to reopen my clamp, and we are going to start. All right. I could then check to make sure with Francis is, as that is running, since potassium has a tendency to burn, similar to Benadryl, that I may just check and see if that is burning after a little bit, once it's been running for a little while. If I need to, I could then slow it down a little bit, so long as we get it in as quick as we're able to. That would be fine. I could take these off then. I'd sanitize my hands. And now Francis complained about some abdominal pain. I'm going to get rid of some of my stuff here. Francis told me has an allergy to codeine. One of the things that we have ordered up is going to be morphine, 2 milligrams IV push. So I've been in here with Francis. She's still the same person. I know who she is. I got that made up. So what I then have is my morphine, which I drew up. We have 10 milligrams per 1 milliliter. As that would then come out, it is 0.2 milliliters for 2 milligrams, shown here.
If I can get it to focus.
There. Thank you, Zach, my illustrious holder. All right. So then, since I have that here and I'm dose accurate, I'm then going to confirm Francis Christian 324.42. She's going to get 2 milligrams IV push. She can have it every hour, PRN for pain. She has not received anything. That IV push is going to be over 4 to 5 minutes. Francis Christian 324.42. She's getting morphine, 2 milligrams IV push. She can have that every hour, PRN. She has not received it at all yet. Francis Christensen, 324.42, is getting morphine, 2 milligrams IV push every hour, PRN. She has not received any yet. Now that I check that here, what I'm going to do, since I have that, I'm going to throw on some gloves because I will need it here in a little bit when I then give her medication. On clean gloves. I then have a label made up since we are going to put this in via pick line. We don't want to build up any pressure. We want to, versus being in a 1 mil, we're going to use a 10 mil syringe. So I have that here. I have my little air bubble put in there. What I can then do is take off my cap here. Off my cap using my needleless access. I'll then inject my 0.2 mils, my 2 milligrams morphine into here. Cap that off. That could go in the sharps container or reuse. I'm then going to recap. I'm going to give it a little shake. I have my label made up already. That way I don't confuse what exactly I have. That way it's labeled. And if it sticks to me, that's perfectly fine. Get rid of this. That way I then have labeled, even though it might be hard to see, morphine, 2 milligrams diluted in 10 milliliters. Alright. Now that I'm here, I'd have my flushes. I'd let Frances know that we're going to give her some morphine for that abdominal pain that she has rated at a 9 out of 10. So pretty bad. I got some IV flushes here. One thing I would need to do is, since I'm not going to use the second lumen and we're going to push here, would be to check compatibility. I already checked my Betty book to make sure morphine is compatible with both potassium chloride and with normal saline, which it is. And since we're using a pick line, we have a line that is open, so we know it is patent. If we didn't have a patent line, we would do a 10 mil flush to make sure that that line is patent before giving our med. But since we know that this line is open and running, we can then just get started with the good stuff. Throw this out. I'd sanitize my port. 15 to 20 seconds, letting it dry. Taking my morphine. Alright. Attaching this here. IV push morphine would go over 4 to 5 minutes, and we would use a pulse technique. But what I would then do is speeding this up. I did say 4 to 5. We'd use that pulse technique. I'm just speeding this up for the process of our video. So we would say, as I'm getting closer to, we're going to say 4 minutes that I've been pushing this. Frances is still doing fine. As we go ahead and give the last bit. So I would detach that, throw that away. Alright. And we want to make sure that we get all that push med here. Since we detached, we're going to reattach another flush. Sanitize again, 15 to 20 seconds. Let it air dry. I then have my flush. Make sure I don't have an air bubble there. Using our 10 mil flush for our pick, we want to use a pulse technique. That first 5 mils we would push at that same rate, so I'd probably push 5 mils over the course of 2 minutes. But we'd use that pulse technique as we pushed our med. And we're going to simulate that as I get to 5 milliliters, that was over 2 minutes. And then you would pulse flush the remainder of our saline flush. Hash. I'll restart these as it says it's occluding. What I could then do is either sanitize. Since we still have fluids running, we'll let that run, but we could always put a Kuros cap over here to make sure we could access the site later, not have to worry about wiping it down. I would dispose of my stuff in normal containers, but we're recycling because COVID. Alright. Alright. What I could do also is, since she was right in that pain so badly, sanitizing my hands. I'd check back with Frances maybe after 5-10 minutes, see if that pain is getting better. For her being a little bit older, morphine might just knock her out. We would see. CT is going to be coming later, and as it shows here, every few days since she is getting that, using that PICC line for her chemotherapy, we want to make sure that that dressing is changed, and it's due to be changed today. So I'm just going to bring my table around here. As long as Frances is feeling all right and CT hasn't called yet, we're going to get her dressing change done right away. So even though I'm still here, it's still Frances. We are then going to get her dressing change done and out of the way. Alright, hands have been sanitized. Frances, what we're going to do is change that dressing. First thing I'm going to do with that is we always want to check for infection with these lines. So what I'm going to do is I'm going to measure your giant python here. So what we then do is from our insertion site, we come up 6 inches, and then we're going to measure in centimeters. This is starting at 0 here. And carefully not to disrupt that PICC line. We'd wrap that around. Maybe if I don't twist the line. Yeah. We'd measure, and it looks to be about 245 centimeters. We would check that versus the baseline. Anything more than a ½ inch increase could be a sign of infection or infiltration. And then another thing I can then do is I'll straighten this line out, and I can measure in centimeters from the insertion site up to like the lumen end, calling that approximately 170 centimeters, and we'll check that after our dressing change to make sure that the line hasn't moved. Alright. Frances has been telling me that she's been doing fine lying down, and that she doesn't need any oxygen right now, even after getting her morphine. So she's doing all right there. So what I would do at this point, I got this, I got my dressing change kit, my gloves are here, sanitize my hands. She would have to wear a mask if she could tolerate it, and I have one of my own on, or else otherwise I would put one on. So open this up and away from me. Got this mask here. This is going to come out. This mask will go on Frances as she can tolerate it. I'm just going to set it right here. I'm going to hope that that doesn't come off like my last video. Then I'd sanitize my hands again, and I would don clean gloves. So now with my clean gloves on, I'm just going to reach in, grab my sterile field, try my best just to hold it on the corners. It's unfolding very nicely. We'll go shiny side down. France has been very cooperative, and her pain is coming down. It's been 5-10 minutes of him checking in with her. That way we're able to better access our site here. As long as I have my clean gloves to get at my equipment before I were to put sterile gloves on, I'm just going to take my Tegaderm out of here. I'm going to open it up to make it a little bit easier for myself. Sometimes these things can get tricky. I'm going to set that right there. Now I have this set up with my gloves. I'm then going to anchor my sight here. And I want to say that even though somebody put a dressing on here, that it looks like it was an IV dressing and not a CHG and a central line dressing. Pulling this up and around. Thanks, friend. Always nice to have an extra set of hands. All right. All right. So taking this off, I'm assessing the site. That appears to be fine. No redness. Finicky line that she has. No redness edema that I can see at the site. Measurement was good from baseline. I would also check the dressing for foci. There appears to be no purulent sanguineous drainage at all. It'd be clean. That would then come off. Alright. I'm going to take off my gloves. I'd sanitize my hands again. Before I get started, I would check with Frances if she has any allergies to any of our cleaning supplies, such as isopropyl alcohol or CHG, chlorhexidine. She says that she has an allergy to betadine, so it's a good thing we're not cleaning with that. If it was isopropyl alcohol, we'd then use betadine to clean. I'm going to open up my sterile gloves then. And with that open, and reach and pinch here for my left hand. Should not touch outside, so that'll be all right. Reach it down and in here. It's a good thing I grabbed that before it flipped over. All right. This will come on. Now that I have this here, what I'm going to do, I'm going to reach in. I'm going to use my non-dominant hand here. Grab my little pincers, and this is what I'm going to use to hold my line while I'm cleaning. So now that I have this here, what I would do is I would probably have a bunch of these with isopropyl alcohol, but what you would do is I'll simulate this part is you would come at the insertion site, cleaning up and around. You may have to grab another one, cleaning in a circular motion around the outside, grabbing another one probably, cleaning up our line, rotating, doing all of our sides. and across the bottom, holding there. That would then get thrown away. I'm just going to set it off to the side here. I would then take my chlorhexidine scrub. You would snap, push, maybe shake it a little bit, activating those agents. You then take, using burst movements, we're going to then do a window boxing across the top, along the side of the sights, along here, and the bottom. You'd allow that to dry. This would get thrown away, but I'm just going to set it off to the side. I would then take, this is going to simulate my skin prep. So on this, once it's dry, I'll take the skin prep in that same motion, window boxing our sight and across the bottom, allowing it to dry. You'd throw that away. It's just going to get set off to the side. Then, once it is dry, we are then going to take our Tegaderm. I'm going to set this down best I can along here with it being cleaned. These could get thrown away or set off to the side. Now open this up, throw that away. Alright, then we would take this here to present the site best we can. Our best to preserve that line. Use my sterile film a little bit to help me out. Boxing this along here. Alright. Well, since her mask came off, she doesn't seem to be tolerating that. I'd tell Frances to turn her head away. Let's go with garbage. Take our sticker, help secure that line. I could then initial it, time and date. There, thank you. That finishes up that part of this. I would take my sterile gloves off, sanitize my hands. Now that that's all running, I'd get stuff cleaned off. After sanitizing my hands, I'd take Francis' mask off, my mask off, sanitize hands. I would then document how well that was tolerated, making sure that I remeasure from the site, making sure that that pick line didn't deviate at all from that 170 centimeters I measured before. Clean up supplies, document that I had given the potassium, document that I IV pushed that morphine, probably document a reevaluation of that pain assessment afterwards, documenting my central line dressing change, how she tolerated everything, placement of my line, check my measurements from that first to make sure that the line isn't infiltrated and that the position hasn't changed. And then we'd make sure Frances is in a safe position, give her call light, bed at the lowest position, side rails up, see if she needs anything else, make sure she is safe, and then we will probably come back around after a little while to take her to her CT scan. And that ends my video.